Now, as a man, you notice that you've got a new lump in your armpit that you've never had before, and you're worried, thinking, could this be cancer? What else could be causing the lump in my armpit? But always think of things that happen commonly. It's not always cancer. So, for example, one of the causes of a lump in your armpit could be a boil. It could be a cyst, or it could be a lipoma, or swollen lymph node in reaction to an infection in one part of the body. So these are some of the common causes of lumps in your armpit. So with a boil is usually quite small, it's on the surface, superficial, tender to touch because the boil is inflamed. So when you feel the boil, you'll be like, oh, that's painful. You know that, okay, I've got a boil. And a boil can be due to a trapped hair follicle or a trapped sebaceous gland. And similar to having a boil, you can also have a cyst. A cyst is much deeper than a boil, whereas a boil is superficial, whereas a cyst tends to be much deeper. Again, a cyst can be due to a blocked hair follicle or trapped oil gland, and usually a cyst can go away on its own. Sometimes a cyst can become infected to form what we call an abscess. An abscess is tender, hot to touch, red, and quite big and painful. And this abscess usually needs to be treated majority of the time. I also mentioned lipoma. A lipoma is a fatty tissue that you normally find in the structures of the muscle, and sometimes you might feel a lipoma can be firm, it can be rubbery, and it can be mobile compared to other types of lumps, and that's a lipoma. A lipoma can stay the same size, or a lipoma can get bigger in size. If you have a lipoma, you might need a doctor to confirm that you've got a lipoma, because how else would you know that it's a lipoma? Again, I mentioned about swollen lymph node. A swollen lymph node is usually a reaction to something that's happening in your body. Maybe you've got an autoimmune condition, whether it's arthritis or thyroid condition, diabetes, or you might be unwell, you've got the flu, you've got the cold, or you've got a throat infection, or any infection that's happening in your body can cause a swollen lymph node. Now, once the infection is treated or the infection goes away, the swollen lymph node would usually go away on its own, and it can take 3 to 5 weeks on average for the swollen lymph nodes to disappear. A normal lymph node is usually a pea size, so a swollen lymph node would be larger than a pea size shape. In some cases, a swollen lymph node might be slightly tender to touch, and you should keep an eye on a swollen lymph node that persists for more than 6 weeks, because then you start thinking, what could this be? Could this be cancer? Now, swollen lymph node is one of the early signs of cancer in the body. And we know that one of the most common signs of cancers that can present with a superficial or swollen lymph node is Hodgkin's lymphoma, as well as non-Hodgkin's lymphoma, or let's just say lymphoma in general. Lymphomas present with lumps, whether it's in the armpit and the groin, in the neck. So you don't just want to rely on feeling the lymph nodes in your armpit, you also want to check lymph nodes along your neck, you want to check lymph nodes in your armpits, as well as lymph nodes in your groin. Look out for other symptoms such as night sweats, fatigue, just feeling generally tired, weight loss, loss of appetite. These are symptoms and signs that this could be cancer. These are not symptoms and signs that you would expect with a boil or a cyst or a lipoma. Other conditions to suspect that can present with similar symptoms to a lymphoma would be tuberculosis. Tuberculosis can also present with night sweats, weight loss, and fatigue. And that's why you definitely need to now see your doctor for further investigations to find out what's going on. And your doctor would usually send you for some blood tests to check for your inflammatory markers, your white cell count, your full blood count, check if you're anemic, as well as do tests for maybe tuberculosis. Hodgkin's lymphoma, you might expect to see raised white cell count, raised C-reactive protein count. This might then lead them to do blood films to see if you do have abnormal white blood cells. With tuberculosis, your doctor would want to check your sputum sample, as well as do a chest x-ray. As I mentioned, a swollen lymph node is not specific to lymphoma or tuberculosis. Swollen lymph node can present with lung cancer as well. You do not have to have a cough to have a lung cancer. You do not need to smoke to have a lung cancer. Lung cancer can occur for many other reasons, so it's important to do a chest x-ray regardless of whether you're having a cough or not. This will then lead on to further investigations such as a CT scan, MRI scan, biopsies, depending on what's going on. Also, another condition that can present with lumps in the armpit is called Hyradinitis suppurativa. Hyradinitis suppurativa is an autoimmune skin condition where you present with what feels like lumps, and it's not just one lump, you might feel several lumps in the armpit. When they become inflamed, they turn into abscesses, they become infected, and usually you need a long course of antibiotics. One of the choices of antibiotics is lymphocycline, which is usually taken for many, many weeks, sometimes 2 to 3 months, or even more in some cases. And this is why, as a man, it is important to do examination of your armpits. It's quite simple and straightforward to examine your armpits. It's not rocket science. You take your palm, raise your left shoulder up. You put the palm in the center of the shoulder, and in a circular motion, you just gently feel for any lumps, and then you gradually just put your arm down as you feel. Feel for the center, go up, go to the left, go to the front, go to the back, go down. Also, a lot of men don't realize that you can have breast cancer too. I know 1 in 200 men have breast cancer, so it's relatively rare. But if you've got a lump in your armpit, now is the opportunity to now feel your breasts, because you can have a lump in your breast that could be a clue as to why you've got a lump in your armpits, because the tail breast extends into the armpit. So also important that while you're doing this, check your breast as well. Do the same for the right armpit. Again, put your palm in the center, put your palm down, or you can put your hand over your shoulder like this and then just gently feel into your armpit. Look for all the structures. Usually there's muscles, there's veins, arteries, any lymph nodes, or any lump that feels swollen to you. If you have a cancer, apart from swollen lymph nodes, sometimes a cancer can also present as a mass that's hard to feel, quite firm, immobile, like the cancer doesn't move. It might feel irregular in shape. This is a clue that, okay, this is not a lymph node. This is not a lipoma that's usually soft, rubbery, and mobile. This could be cancer, and that's when you need to see your GP to find out exactly what's going on. If you have a boil or an infected cyst or an abscess, the question is, how do I treat this at home without having to see the doctor? Quite simple. Get a flannel, put that in warm water, and then for 10 to 15 minutes, you want to apply the warm flannel to the area. Do this 3 to 4 times a day. Do that for about 5 days. You'll notice that the ball or the infected cyst will release its contents, and then pus will discharge. In addition, you can go to the pharmacy, buy magnesium sulfate paste. Magnesium sulfate paste has a drain effect. It helps to draw out the poisons from your body, helps to draw out the pus. You can apply magnesium sulfate paste as many times as you like to the area. It helps to draw out the pus. In addition, you can also have warm baths with salt. Epsom salt, similar reaction to magnesium sulfate paste. Put Epsom salt in your warm bath, lie in your warm bath for 10 to 20 minutes. Again, similar to the magnesium sulfate paste, it helps to draw out the pus. It helps to dry out the boil or the infected cyst as well. If you have an abscess, that might be more difficult to treat with just warm flannels and magnesium sulfate paste. You might need a course of oral antibiotics. Usually the choice of antibiotics, if you're not allergic to penicillin, is called flucloxacillin, which is given for 7 days. And if it's more of a severe abscess than a mild abscess, you really should be going to hospital, because you need to get the abscess incised and drained. In some cases for boils, you might also need to use an antibiotic similar to abscesses, such as the flucloxacillin. If the treatment is not working, despite using the Epsom salts, despite the magnesium sulfate paste, despite the warm flannel, the boil's still there, then you can use oral antibiotics. If it's quite small, quite localized, you can get away with using topical antibiotics. Fusidine cream is enough to apply 3 times a day for 7 days. Fusidine antibiotic cream can do the job as well. So men, remember, it's important to feel your armpits. Lump in the armpit is not restricted to women only. Lump in the armpits can appear in men as well. Any lump that's persistent, even for more than a week or 2, don't just assume, okay, this is a lymph node that will go away in 3 to 6 weeks. If you find that the lump is persisting, then still get it checked just to get a second opinion, just to get that peace of mind as well. And if it's going on beyond 5 weeks, definitely get it checked out. Like I said, it could be cancer, it could be a lymphoma, it could be lung cancer, it could be leukemia, it could be any cancer, or it could be an infection such as tuberculosis. Maybe you've been in contact with someone who had TB, or maybe you've traveled to a country where TB is quite endemic. So it's important to check for all these possible causes. Now, I hope you enjoyed this video. Please feel free to share, like, and subscribe.